Well, this brings us to the end of our plenary session today. I hope all of you found this as exciting as I have today. I was just reflecting back, it's only been like 7 or 8 years ago, but we hosted a series of conferences here on big data and biomedicine and just how far we've come in a comparatively short period of time. I realize in terms of technology, that's a very long period of time. But the level of discussion, the types of issues and topics that we were discussing today, while they are derivative from topics we've covered in previous symposia covering biomedical data science and other related areas, they really take the opportunity and the challenges to the next level. But I'm confident that the people who spoke here today, the people listening on the live stream, the people who are here in the room with us, that together we can navigate these challenges and really leverage the opportunities to dramatically improve healthcare and to improve health and all the processes associated with health and healthcare. I do want to close by thanking first the organizers of the event, the staff of the Office of Strategy and Communications in Stanford Medicine and the event staff. Let's have a round of applause for these amazing people. Hours and hours of time goes into putting together an event like this, and our team does it with such alacrity and so skillfully, and we're all very grateful for the work that goes into making this event such a success. Also, for those of you who are online, there is an evaluation form that appears on your screen, I think about right now. All you have to do is to click on it or to scan the QR code. And please do give us your remarks. For those of you in the room, there are evaluation forms on the tables in front of you. Your feedback really is taken very seriously by us as we plan future events to know what was successful, what we could do better in the future, what you'd like to hear about more in the future. And finally, I want to thank the faculty co-leads for the symposium that also spent hours working with our team on organizing the speakers, coming up with the themes for the sessions, and inviting the speakers and the panelists today. And I want to acknowledge those co-leads, Drs. Kurt Langloats, Sylvia Plevridis, Sami Koyejo, David Magnus, and Manuel Rivas. Let's have a round of applause for these faculty members. Thank you again for joining us, and we look forward to staying in touch. Please do send us your ideas, your thoughts. We hope that symposia like this will be a regular feature of RAISE Health moving forward, and your feedback will make sure that we're organizing them in the very best way possible. Take care and have a wonderful day. Thank you.